is Lucy Osborn. I'm a registered nurse and I work with paediatric patients. I'm also a unit convener and lecturer at Swinburne University. I'm an emerging nurse leader for the Australian College of Nursing, and I am the chair of the Next Generation Community of Interest within the Australian College of Nursing. My career has been like most nursing careers. I've had ups and downs and been in a few different areas of nursing. I started as a graduate nurse in Adelaide in South Australia working with adults, but decided I wanted to work with the paediatric population. So I moved to Melbourne to work with them here. After that, I continued to love professional development and decided to become a university lecturer and started working as teaching Bachelor of Nursing students. So I'm a huge fan of continuing development and teaching clinically and at the university level, and really like those opportunities that nursing gives us. So my nursing career has had a clinical focus, but also has a huge focus outside of the clinical world. The Scrubs That Fit are a blog post that's posted within NurseClick, the Australian College of Nursing's publications section of their website. They are blogs that are able to be shared upon social media, and I have written about 50 of them since about 2017 when I first started in the Emerging Nurse Leaders program. I write about everything from my first day as a graduate nurse to the hardest time in nursing. So I've written about death, dying, love, everything that comes in between. So some really positive things, but also the things that were the hardest parts of being nurses. The Scrubs That Fit started as a way for me to practice my writing skills and also keep a little journal of how I was feeling as an early career nurse. When I started writing, I never thought that my writing would be good enough to be published, but the Emerging Nurse Leaders program with the Australian College of Nursing gave me that platform and gave me the support I needed to get my work ready for publication. And I'm really thankful that's happened because I've had a really great support from the community about how important me delivering my personal journey has been to them, to show them that they're not alone. So it started as a place for me to jot down my own thoughts and feelings, and it ended up as something where I pursue different areas of nursing to show that students aren't alone and that nurses aren't alone, and that we all go through these types of journeys no matter what kind of nurse that we are.
The articles on the Scrubs That Fit have been really useful for me in terms of gaining more information on what it's like to be an actual nursing student and an early career nurse. They're very raw. They are, they're personal information on experiences, and I found them really useful, especially the article on applying for a new graduate program. And there was one on your first day of nursing. Essential items to take on your first day of nursing, and I found them very valuable.
So I'm really lucky that the author of the Scrubs That Fit is actually one of my unit conveners at uni. And most of all, I find it really helpful to read them and know that I'm not alone in experiencing the things that I am experiencing. There's helpful tips about how to cope as being a student, but also making that transition to being a new grad, which I know can be really scary for people. And I think it's just so validating to be able to read that I'm not the only one that feels like that, and it answers the questions that I don't feel I can always ask to someone face to face.
I wrote about 3 different articles during the COVID pandemic, and all of those were surrounding how to survive as an early career nurse, specifically during COVID. One of the hardest things was our family, friends, and people around us were relying on us to have the most up-to-date knowledge about the COVID-19 virus. And in the very beginning, it was really hard to find that information because even our workplaces were really struggling to keep up with the amount of information that was coming in. So not only were we being bombarded by questions from our patients, it was also the community around us because we're the health professionals within that. So my first article was about how to survive those COVID guilts when you couldn't quite step away from everything that was happening around the workplace and around home, especially for those within Victoria, because we were absolutely saturated. It was everywhere. It was every single part of our life was affected by COVID. The second one, actually the last one that I wrote about, was about taking time off when you were burnt out. So I had a bit of a break from my writing between the end of the hard lockdown, and then I went home for an entire month, and I took some time off nursing, and then I reflected upon why that was so important for me to do. As a nurse in Melbourne, I really struggled during the lockdown because I was very, very isolated. I didn't have any family here, and I was working so incredibly hard every day. So I took a leap of faith, took a month off, and then reflected on why that made me a better person and a better nurse when I came back.
There is a lot of quality information out there on the nursing profession, but none that covers the human aspect. As nurses, we feel, we have thoughts, we have needs, and I often feel like the other articles available do not sort of support that.
It's really great to have this sort of information in a blog format because I can go and read it when I'm thinking of a certain topic, like how to present myself in my graduate interviews. I can go and search and see if there's been anything written about that. And it's helpful because if there is a really important piece of work that has resonated with me, I can refer back to it and also send it on to my friends so it can help them too.
You know, we're also thinking of long-term sustainability. We don't want our nurses to get burnt out. We don't want them to be stressed. We want them to have a really fruitful career.
One of the most important things about being a nurse is always challenging yourself to become better. Healthcare is always changing, and we need to be relying on each other as nurses to share the experiences that we have on the day-to-day basis. So for me, I like to share my experiences through the blog, and that can evolve into something really cool. So I can be doing this weekly, monthly, or just have a gathering of people that follow this throughout my posts. But for other people, it can be a little bit trickier. And I really encourage you guys to open up your networks and to be talking to people you might not necessarily talk to at work. So find those nurses that you haven't had the chance to really get to know and ask them about their personal experiences as nurses. And this goes for anyone at any stage in your career as a nurse, whether you're the most experienced on the floor or the most early career, because everybody has something to share and we have something to learn from every single one of you. Take it over a cup of tea, a coffee, a biscuit, or even go out for a few drinks. It's the best way to create a great morale within your workplace.